Alrighty, y'all. So the topic for today is maneuvering the mental health system. In an age of COVID, and where we're talking about the medical system, it's getting more and more strained. And so, as a physician and a scientist, I encourage everybody to get vaccinated and boosted if applicable and possible. So please talk to your whoever your medical professional is in your life to see if you qualify for those things. But that's the medical system, and it's under a lot of strain. Well, the mental health system is also under a lot of strain, but it's been under a lot of strain forever. And so, one of the to give you a little bit of history about the mental health system, because it's gone through lots of iterations, meaning there's been lots of different phases of things. So, for example, back in the 60s, early 70s, the mental health system was really in 50s, so 50s, 60s, maybe 70s. The mental health system was known for, asylums and sanitariums and places where they would house a whole bunch of people who were suffering from chronic mental illness all in one place. And that's movies like One Flew Over the Cuckoo's Nest, where they're doing electroconvulsive therapy and that sort of thing. And everybody's like, oh my God, that sounds horrible and barbaric. And I'm like, well, I mean, the doctors there were not trying to hurt anybody. So it may look that way, but there's actually a method to all of their madness. But the thing is, they didn't have all these fancy schmancy medicines that we have today. And so they had to use a lot of different types of therapy, psychotherapy, psychoanalysis. And they would spend a lot of time with patients to try to figure out where the hiccups were coming from so that they could help them feel better. And so that just took a lot of time. And so if you went to the hospital, you'd be there for 3 months while they figured out and work with, families and social services and that sort of thing to try to get them help. Well, even then, paying for all of that was not very easy, but the economics of the 50s and 60s and 70s were a little bit different. Well, the 80s and 90s came along, and with managed care and the explosion of health insurance, one of the hiccups with health insurance is that health insurers followed the footsteps of the government. And so back in 1965, the government said, hey, this is Medicaid and Medicare Act. The government said, hey, we're actually going to put out a fee schedule, how we pay for things, and we're going to pay for procedures more than we pay for non-procedures. So in other words, if you cut something off, we're going to give you $3. If you're just sitting and talking, we'll give you 25 cents. And so what you started to notice over the course of this 70-year experiment is that the things that involve cutting or related to cutting or inserting things into people tend to start being valued more, and the things that don't involve those things tend to be valued less. And so you get this big divergence. And so now we are where we are. As a result, you have lots of people trying to go into orthopedic surgery and neurosurgery and emergency medicine and anything dermatology, again, anything where there's cutting. And then you don't have people tending to go into the talking side of things. So family medicine, pediatrics, psychiatry. I mean, there's some trends that are changing now. But in any case, what that means is you have a shortage. You have had a shortage, and you will continue to have a shortage because those financial incentives, those financial forces have not changed. And so that's one hiccup to why there's not enough psychiatrists, there's not enough psychiatric nurse practitioners, there's not enough psychiatric physician assistants, there's not enough therapists, there's not enough counselors, there's not enough psychologists, because the reimbursement, the way that the health finance system works, makes it very difficult to be in mental health, because again, we're not cutting on folks. So that's number one. Number two, the cost of being in the mental health field is really, really high. So I went to medical school. I graduated with $200,000 worth of debt. Mm-hmm. And again, I didn't grow up with money, still don't have any, but that's another discussion for another day. Same thing for psychologists and therapists. I mean, going to school is expensive. Testing and doing your clinical hours is expensive because you don't make a lot of money while you're doing that. And so as a result, you just have a diminished workforce. So the question is, how do you maneuver the mental health system? Number one, recognize that there's just not enough of us. And so there is a scarcity. So how do you get to where you need to go? Number one, one of the absolute best ways is you just pick somebody and ask. And when I say you pick somebody in the mental health system, because we generally know where to find other people. It's not well organized. So the infrastructure, the communication infrastructure of the mental health system is not very good, as compared to like if you were being treated for cancer, if you were going to get a hip replacement, those communication infrastructure things are very good. You'll call the hospital and they'll immediately route you over to this person who will route you over to that doctor, and that doctor can get you in, and and it's very, very structured. And the mental health care system, it is not as structured, but we tend to know where people are the best. And so literally just reach out to any therapist that you can find. Another way is to Google it, right? So, but keep in mind, one of the hiccups with Google is that Google is it is a money making machine. It is not there to like to be your pathfinder, your guide through all of that. It is literally designed to sell ads. And so when you start to Google, and whoever pops up on that first page, especially if it says, if there's a little ad button beside it, it means that they paid to be where they are. And so that person may or may not be a good fit for you, but it's a start, because even then you can pick up the phone and call them and say, hey, this is what's going on. Can I come and see you? And if they go, oh, that's not what I actually do, but here's 2 other people who may be a better fit for you. So that's another option. I do want to give credence to the fact that the mental health system actually has 5 different levels. And it's not like 8 levels of purgatory. I just thought about it. I was like, wait a minute, this isn't Dante's Inferno. So no, we ain't trying to burn people up or, be mean to folks. But the goal of the level system within the mental health system is to appropriately address acuity. So acuity meaning, how fast do you need to get a resolution to something that's going on? And so the least acute, the least worrisome level is the outpatient level. And so outpatient basically means that you don't need additional care more than once a month with a psychiatrist, or once a week with a therapist. If you're needing more than once a week with a therapist, sometimes they can meet with you twice a week. If you need more than twice a week with a therapist, then you're probably needing the next level up, which is what we call intensive outpatient. So same thing goes for a psychiatrist. So if you're seeing a psychiatrist or a nurse practitioner or a physician assistant, and you're needing to see them more than once a month, then you're probably going to need IOP, intensive outpatient. And what that is, it's a structured program, depending on which one you go to. Some of them are like 3 hours, 3 times a week. Some of them are 3 hours, 5 times a week. But it is, when I say a structured program, you go in, you sit. A lot of it is group therapy. So you'll be with other peers, your age and situation. You'll work with a therapist. Quite a few of them will have psychiatrists that can make medication adjustments while you're doing the program. You always get to go home after your sessions, so you don't stay overnight. But it's kind of a nice level of care to help those folks who are really struggling with whatever. As you can imagine, with COVID and quarantining and all that stuff, some of those programs are having to change things up and think on the fly, because it's really hard to do group therapy in masks because we're very communal creatures and we respond to body language and that sort of thing. But if you call an IOP program, they can get you set up and hooked up. So that's the next level. So first level, outpatient. Second level, IOP. Third level is what we call partial hospitalization program. It's kind of like IOP on steroids. So whereas IOP is generally 3 hours every 3 to 5 days, PHP is 6 hours, 5 days a week. So it's almost like a job. And for my kiddos, my young kids and my adolescents, is basically school. So they will literally do school at the PHP. They get up, they get there about 8 or 9. They stay all day long. They do school, they do therapy. They leave at 3, 4, or 5. And then for adults, same thing. It can be 8 to 5. It could be noon to 6 or 7, just depending on scheduling and that sort of thing. But the goal is to help you feel better, because we don't want you in the hospital, because hospitals, number one, are really expensive. that hospitals are also very disruptive because you're not in your normal setting. And that means your pets are neglected, or your family is missing a person because hospitalization means that you're just not there. So outpatient, intensive outpatient, PHP, and then if for some reason someone's having a really difficult time, we can, especially if there's a safety concern, then we recommend inpatient. So inpatient is basically going into the hospital. So one of the things I always have to say about hospitals is that we don't intend them to be scary. We intend them to be safe. And so they are not designed. I wouldn't say that they're not designed for comfort, because they're supposed to be comfortable, but they're designed for safety. And so when you go in, you're going to see that things look a lot different, because they hire special safety consultants to make sure that there are no blind spots, because we want to make sure that that you're safe the whole entire time that you're there. In an inpatient setting, the key is to do really intensive therapy as quickly as possible, and to get medication started and adjusted as quickly as possible, because most times we don't have a whole bunch of time with you. Remember, back in the 50s and 60s, you could stay there for months and months and months, and we had lots of time to work with you. Nowadays, the average stay is like 3 to 5 days, maybe 10, depending on what's going on. And so to be able to do meaningful and quick work is really, really difficult. And so my hats are always off to the inpatient doctors who are holding down the fort. During inpatient, your whole entire schedule is structured. And that's actually part of the treatment plan. Is we want you to get up at the same time. We want you to have breakfast. We want you to interact. We want you to go to therapy. You have to participate in groups. You have to work on your therapeutic goals. You have to do family sessions, or plan for discharge, and how you're going to continue to work on your mental health. Like, it's a very intensive thing. It is not just throw them in a corner and not pay attention to a person and take their money and kick them out. That is not what happens. Some folks feel that way, but that is not the goal. And especially nowadays, there are lots of regulations in the industry that should keep that from happening. Now, of course, if that happens to happen to you or your loved one, by all means, make reports where you need to make reports. But in general, it's supposed to be a safe and predictable space so that you have time to feel better. So that's the inpatient level. So that's 4 levels so far. And if you think about it, in the medical world, they only have like outpatient. So like your family doctor or internal medicine doctor, and then they have the hospital, but they don't have the 2 middle parts well, I guess maybe like an ambulatory surgery center, but forget them. They got their own podcast. I ain't talking about them anymore. So we're going to talk about mental health. So those are those 4 levels. The 5th level is something, especially in Texas, that we don't have enough of. It's called residential treatment. Let me rephrase that. We don't have enough of for teens and kids. We do have quite a few residential treatment centers for adults with substance use. But we don't have very many for adults without substance use. And so what a residential treatment center is, it's a very structured program where I can monitor you 24/7 over 10 to 15, 30, 90, 60, 90 days, sometimes up to a year or longer. And so other states, because other states spend more money on their mental health than Texas does, there tends to be more of those in other states. These can be very, very helpful for folks who need a lot of structure for a long time. And so, in other words, if you've been to the hospital quite a few times and you're still having difficulties, or that family member is still having difficulties, then a residential treatment center or a residential treatment facility, so RTC or RTF, can be super, super helpful. And so if you're in Texas and listening to this message, call your representatives and senators and please tell them to fund more mental health facilities so that we can get people to the care that they need. So there's a few other things that happen in the mental health world that y'all need to know about, but those are the 4. I won't belabor that point. Those are the not 4. Those are the 5 settings that we use to maneuver the system. The key to remember is you get what you pay for. So in other words, if we're not investing in our mental health infrastructure, then it won't be there. Same thing for our workforce. If you don't invest in the mental health workforce, you ain't gonna have anybody, right? So I encourage y'all to always keep those things in mind and to continue to be mindful, which happens to be the name of my practice. So it's called Mindful. If you visit www.findmindful.com, you can learn more about all of us and what we're up to in helping people feel better and reintegrating mental health into our modern lifestyle. See, you like that tagline.